Morning, everyone. It is 10:30, so we can go ahead and get started. My quick housekeeping blurb, don't forget, if you have questions, any information that you want to send in, please make sure to send that to all panelists. So with that, I do have a couple updates that I want to make sure folks are aware of. One, the connection walkthrough demo that occurred last week on February 8th. There is an email blast going out this morning if you haven't seen that yet. That walkthrough demo is now available in the MODD content self-registration portal. That's our Relias portal that is out there available for everyone. This walkthrough, it showcased the requirements gathered and configured in connection around ISP planning and service authorizations. And for those of you that are on the call that may have your own provider subportal, that is a subportal of the division, all of the connection walkthrough demonstration modules have been pushed to your portals. So you will have each of those there. And the second piece, In the Loop newsletter, that went out this morning. If you are signed up to receive email blasts, that should have came directly to your inbox. We changed up the format a little this month. And so going forward, you will see it coming directly to your inbox in that format instead of as an attachment. So those are the two items that I have, and I am going to pass the baton to Angie this morning.
Hey, good morning, everyone. Hopefully my sound is working okay. Heike, can you hear me?
Yes, ma'am.
Okay, perfect. It's been a little glitchy this morning, so you never know. Yeah, so happy Friday. It looks like it's beautiful outside, sun is shining, but I'm sure if it's anything like it was this morning, it's still freezing out there. So we'll get you started here. I just have a few updates. Our budget is in full swing, so budget season is alive and well. We have had supplemental hearings with the House and Senate that happened at the end of January, first part of February, so we've talked about those a little bit. We did present our budget to the House and the Senate at the end of January, and so that is all moving along. This week on Wednesday we had our House subcommittee, and so that was markups that they were working on. Several amendments were put forward. One of those was for provider rates to increase to $21 per hour for DSP wage. It did not pass, but several members of the committee did acknowledge the need for that increase. So I would expect to probably see an amendment again somewhere along through sessions. So it is getting acknowledgement and discussion at the Capitol. So keep talking about it. One thing that did pass was funding for the tuberous sclerosis fund, and that's for scientific and clinical research. So that was a little extra funding there. Everything else that was in our budget stayed the same. And so now the next step is to move to the full House committee. And then we'll also be waiting for the Senate markup as well. And then the beginning of last week in the House, that was early supplemental markup, and there were no changes. So this is for the 8.7% salary increase or wage increase. So there were no changes there. And then next week on Tuesday, it's early supplemental markup with the Senate. So everything is on track for early supplemental for March 1st. So we'll be anxiously watching what's happening next week and then watching for our next hearing dates. The other thing I wanted to talk about is we've had a lot of discussion with providers and staff about requirements for the residential RN to be the HRST rater for individuals that are receiving residential services. We all know that HRST is an extremely important tool just to help the care teams, whether it is staff for residential services or if it's for the families for in-home services, to identify and just provide that early detection of health risks and destabilization so that we can provide that better long-term better quality of care. At the same time, we also recognize the strain on the residential RNs that are providing oversight just with the current workforce shortage that everyone is facing right now. So there's a couple of different efforts that the division has really been working towards implementing, and we're going to continue to work on. So we appreciate all of the feedback and the support and the collaboration that we're getting. I know it's been difficult, but we're going to get there. The first update that we've made to the process is that allowing an LPN or other staff, as you know, having the appropriate HRSA training, to add and update medication and diagnosis in the system, and really be that support for the RN instead of the RN taking the time to enter that data. The RN will still do the review of that and still be the HRSA rater, but just that takes a little bit of time off of their plate too. In addition to that, the division is working in collaboration with providers to develop a red cap reporting, and this will be a path to let us know when there's not an RN available to actually be the HRSA rater. And so there will be a specific field in that tool that will allow the provider to indicate the actual trained rater that will be taking the place of the RN while the RN is out or not available. So our hope that being able to make some of these changes is that we're going to allow the providers in the division to really partner together, not only on HRSA, but just being able to support providers with the integrity of their quality care. We really want to be supportive of that, as well as the care for the individuals we serve. So continue to watch for details on that red cap reporting. We are excited about that. This week, our NCI staff stability, I'm sorry, not ours, the National Core Indicator Staff Stability Survey came out. It's now called the State of the Workforce. The 2021 report data was released this week. And there's some one-pagers. We'll get information out, links to that for providers and individuals to see. But basically, this is 29 states that participate in the survey. It shows what the average workforce looks like, you know, gender, ethnicity, median hourly wage, benefits, turnover ratios. It has the national averages, and then you can see the average for each state. So for example, turnover rate for this 2021 report is national average is about 43% for DSPs. That's pretty significant still. And then Missouri specifically is in that upper range of the turnover, closer to around the 50%. So it's interesting to see. It also helps us tell our story as we're talking and sharing our struggles with the workforce shortage and where do our rates need to be, what are states paying, where are we at with our wages. It also includes kind of supervisory ratios. It shows that frontline supervisors are supervising about 10 DSPs at a time. It's got information about how providers have responded to COVID-19. So we're going to start digging into that. Again, we were just notified of this, you know, just a couple days ago. So we're going to start digging into the report and sharing more details with everyone soon. So keep your eyes open for that one. And then this week, it's been a busy week. Like I said, we had hearings. We also had Guidehouse visit us. They are our VBP administrative contractor that are really helping us to roll out our VBP value-based payment payments, the incentives, the initiatives, kind of that guide on where we're going to go with these payments and how can providers report to us, how can we support the providers. So they spent a couple of days with us, and we even had some of our providers join us and provide some feedback. So really great conversation that we had this week. We appreciate the time that Guidehouse took with us and the time that our providers were able to spend with us. And we really are just excited. We know it's hard, but we are excited that Missouri is going to be the first ELTSS fee-for-service state, long-term services and supports fee-for-service state, to move towards paying on quality versus quantity. We've done it, states have done it in managed care, Missouri's done it with managed care, but this will be the first time doing it in fee-for-service. So it's hard, but it's worth it in the end. We want to make sure we're paying for that we want to see better quality outcomes for the people that we're serving and caring for. So thank you for your help with that. There are going to be 2 press releases we want to share with you that you're going to see come out. Station MD and then Inelectability. Inelectability is the one that we partner with for the health risk screening tool. They are connecting to the IT information highway. So we are excited about that. They're actually connecting with each other. And what that means for the people that we serve, when someone calls for their health assessment and coordination service to Station MD, and remember, Station MD doctors specialize in care for individuals with developmental disabilities, they will have the HRSA, the health the health risk screening tool at their fingertips to really help them to be able to perform those assessments and the coordination if an individual does need to go to the emergency room or urgent care. What this does is really gives them the additional clinical data to be able to coordinate that care. So we are excited about that. And then a kind of a partner or parallel track to that is our partners with EMI. They have been walking along with us on the data interoperability and connecting to the health information networks, our person-centered plans, and having that accessible to doctors, primary cares, acute care settings for hospitals. They are going to be releasing a press release about how they are going to continue to help us down that path of getting us and our providers connected to the information highway. And really that's so our person-centered plans, our ISP data, is going to be available to those primary care doctors, the hospitals, even to the station MD doctors. And that person-centered plan data, your ISP data, that's really going to be beneficial for the providers, the healthcare providers, to really make those good decision points so they can see everything that's happening in a person's life daily. And so having access to the HRST and access to the ISP is just really exciting for Missouri. So we are looking forward to where we're going with all of our health IT information over the next several months and years. So lots happening there. And then I think my final plug for today is really just continuing to use that health assessment and coordination service in the waiver. That's calling into Station MD. This service is truly an opportunity for all of our waiver participants to have access to the Station MD doctors that do specialize in IDD, to help the individual and their caretakers, again, whether it's staff or family, determine if there really is a need for a trip to the emergency room, to urgent care, or if you can handle it in home and maybe just follow up with your primary care doctor. The other benefit to this service that if it's decided that yes, a trip is necessary to go to the emergency room, the Station MD doctors and nurses coordinate with the emergency room doctors that you'll be going to, so they have all the information available by the time the individual arrives at the emergency room. So that is a lot of coordination. It saves time, it saves frustration, probably trying to communicate everything all over again. So we are excited about that and really want you to take advantage of that. We know that we do have quite a few authorizations in the St. Louis area that we're working through, and so Wendy and the St. Louis leadership team are going to be really working together to kind of get those cleaned up and get those moving. Again, just want to encourage every waiver participant to add this service to their plan. It's a great service. So I think with that, let me see if I have any questions that I can add or respond to. Oh, there's quite a few here. Okay, so for in-home services, the support coordinator is the rater, but again, they're working with the family because the family is the caretaker, so you're making sure you're getting the full aspect of everything that's happening. And then, yes, we're very excited. Yeah, eventually, so the question here is, will the Station MD, the HRST, everything that we're doing eventually connect with the connection? So our goal is, as we're moving forward with this health IT roadmap and the data interoperability, is that all of this will be connected. And so we are partnering with MoHealthNet in the health information networks to really roll that out. One of the things that we are doing right now is we have an onboarding opportunity for home and community-based providers to connect to health information networks. We have, I think, 15 home and community-based providers signed up already to be able to do that. And then we're also working on a process to where we can connect our person-centered plans to all of these systems. So that will be a great thing to have. There will be, we're working on all of the HIPAA compliance. So Station MD and inelectability with the HRST sharing, they do have all of the HIPAA compliant requirements and laws and regulations figured out, so it's all working together. And then we continue to work through that process as we connect providers, and eventually we'll connect connection to the health information network. So that is all part of the process of getting everyone connected. So if you had questions about any type of compliance of sharing data, that will be covered too as we roll all of this out. I think with that, I am going to turn it over to Emily, and I'll keep scrolling through to see if there's any questions I can answer to. Emily, are you ready?
Thanks, Angie. Good morning, everyone. So I'm going to go over Federal Programs Unit, or HCBS updates. Last month, I mentioned that our waiver renewal and amendment public comment period was about to come out or underway. It started January 27th and goes through February 26th. So you may have seen a MoHealthNet alert or public notice, and also the division sent out a blast about the waiver renewals and taking public comments for the changes in the waiver renewals and amendments. And you can get to the MoHealthNet alerts and public notices at the MoHealthNet webpage, and comments can be sent to ask.mhd@dssmo.gov. I think, Kat, if you could drop those in the, thank you. You already headed me, dropping those links into the chat. So next, mentioning the COVID PHE unwinding, the states are hearing that, that the COVID PHE will be ending on May 11th. This is our wind down. This wind down would align with the administration's previous comments to give at least a 60 days notice prior to the termination of the PHE. With that termination of the COVID PHE, that comes into play the flexibilities that we've had in place due to the COVID PHE. So those flexibilities under the 1135 authority will expire upon the termination of the federal public health emergency. So they would expire on May 11th. And those flexibilities that are through our waiver, or what we refer to as Appendix K flexibilities, those expire no later than 6 months from the termination date of the end of the PHE. So we're looking at like November 11th for the the expiration of the Appendix K flexibilities. Kat will put in the chat a link to our flexibility chart that provides a overview of the flexibilities that we have had approved by CMS throughout the COVID PHE. Also indicates what the authority is for the flexibility. So it allows providers and individuals and SDs awareness of the flexibility and then the authority to help start looking at unwinding which ones will end with the right when the PHE ends on May 11th, and which will have that 6 month period to continue to unwind. And we'll also if you listened in to Director Bax's update today, she mentioned also more information coming out to help clarify crystal clear of where the flexibilities land, which ones will end in 60 days or on the end of the May 11th when the PHE ends, and which ones have the flexibility for 6 months. Also, we've kind of, as Missouri, we've been following along with the HCB settings rule transition period. That period for the transition of that rule actually ends May 17th of this year. The purpose of the regulation is to ensure that individuals receive Medicaid HCBS services and settings that are integrated and support full access to the greater community. This includes opportunities to seek employment, work in competitive and integrated settings, engage in the community, and control personal services, resources, and receive services in the community to the same degree as individuals who do not receive HCBS services. So as I mentioned, the transition period for the HCBS settings rule ends March 17th. The state of Missouri has had our HCBS transition plan and plan approved several years ago, and have already completed the pieces in that plan as far as setting up our policies and our regulations, including language in our waiver applications around the HCBS settings rule. So we have been working towards that. We continue to monitor the HCBS settings rule. All states were given the opportunity to request a corrective action plan if the state felt they were not completely ready or fully implemented by the end of the transition period. Missouri is one of 10 states that did not request a corrective action plan. We felt we were ready to go. Our focus will be to continue on ongoing monitoring of the HCBS settings rule, continued education on the settings rule, and baking in those the requirements around the HCBS settings rule into our services, into changes that we make when we bring on new services or change services, making sure that it fits the HCBS settings rule. In the last monthly meeting, I went over that CMS is also doing site visits throughout. They have done several between 2022 and 23. They'll do approximately 15. They recently mentioned that they have 4 more that are scheduled for 2023. And they selected these settings or these states based on heightened settings that states submitted for heightened scrutiny and review. And I also mentioned in the last meeting, or in the last monthly meeting, about the positive outcomes that their CMS was seeing in these site visits, but also those themes that they were concerned about. Themes like participants not participating, or individuals not participating in the plan development, not signing, providers not functioning under the individualized plan, rather they're functioning under provider plans of care, and making sure that they pull in the ISP when their plan of care is developed. Also, an awareness that staff and administration have about the HCBS settings rule. Often when they asked staff and administration to describe the difference between institutional settings, nursing homes versus an HCBS settings, often staff refer to the level of support that people need, rather than the responses related to community integration. HCBS settings services are about community integration. And just some other things just about making sure that individuals that express a desire to work, that is in their ISP, and they're making setting goals towards work, offset community activities that are integrated in the broader community. Also making sure that rights restrictions go through all the necessary steps for due process before any rights restrictions are implemented, and making sure that the providers are not restricting visitors. So those are some of the themes that they saw happening, and things that we need to be sure as providers, as support coordinators, as agencies, that we look to avoid and meet, so we continue to meet the HCBS settings rule in Missouri. That's all I have for today, but let me check the chat for questions. I don't see any specific to the updates that I gave today. I know there's some in here about the Hearst, and Leslie's going to be providing some updates today, and we'll probably get to we'll talk about the Hearst later on on the call. I'm going to turn it over to Holly now.
Thanks, Emily. So I just wanted to give you guys an update. We have had StationMD available as a waiver provider now since January of 2022, so just over a year. And as you know, we released Guideline 86 to help talk about that service and what that service meant. And we got some great feedback from you guys, and we have revised it, and it will be out for posting soon. But I just wanted to give you guys a little update on the changes. We clarified it that the appendix that is part of Guideline 86 is the only documentation needed. You don't also have to do a whole UR packet or provider choice form or anything like that. So we wanted to clarify that. We also wanted to clarify that if it is the first time that you're using Station MD and you haven't had that conversation yet with the guardians to make sure that it's okay to use Station MD, just give the guardian a ring real quick, make sure they're okay with it, and then go ahead and call Station MD. We just want to make sure that the guardians are more aware and have more say. If you have had those discussions with your guardians and families during their ISP year and the guardian does not want Station MD, just give Station MD a call or email Carol over at Station MD and let them know that the guardian doesn't want it. That will help provide like a little stop. If the direct care professional is like, oh my gosh, I need to call Station MD, and maybe wasn't aware that the guardian preferred a different solution. So be on the lookout for that. The new list for January will be coming out. It should be out next week. So that'll be good. We still have quite a bit of a backlog of services that haven't been input yet. And I just wanted you guys to know that the new folks who come in, like the total number of first use for each month is actually really small. So if we can get the backlog cleaned up on all those that have been waiting for their authorizations to be input since February of 2022, then the new months are pretty short. Actually, December was our largest one. We had 92 folks who had never used Station MD call for the first time that month. So that's statewide. And I think we can really provide more service. We're also working with Station MD to update our DMH homepage. So if you're familiar with our DMH public facing website, the dmh.mo.gov, there's a button on there for Station MD. It has lots of great resources and information about how the service works and how it helps connect and coordinate with other healthcare professionals. And we're working on getting some of that updated as well. So that was my big update, just some Station MD stuff. Let me see. There's a lot of questions in the chat box. I'm seeing if there's any specific to. Yes, please. If you guys are talking during your ISP meetings and it's been decided that the team does not want to use Station MD service, just please reach out to Carol, and I've put her email address in the chat box, and let them know. What that will do is if then the direct care professional does call Station MD, Station MD can say, you've declined our services, we suggest you go to urgent care, contact your primary care. It just helps stop that from getting used without the guardian's consent. Station MD can bill Medicaid if needed. So they are also a state plan provider for medical services. And I think that's all I see. So I'm going to go ahead and turn over to Leslie, and everyone have a great day.
Thank you, Holly. Good morning, everyone. And I was wanting to share my screen. Thank you. Yay. And I want to talk about just a few things this morning. What you see on the screen right now, the division sent out an email blast yesterday for an upcoming webinar, and it's titled Avoiding Preventable Death Using the HRST, or the Health Risk Screening Tool, a review of the latest mortality research, and it takes place on March 3rd at 12 p.m. The presenters are Dr. Craig Escuday and Jonathan Crumley, and they're both our partners from Inelectability, and Inelectability is the creators of the Health Risk Screening Tool, or HRST. And just to kind of summarize what this will be about, for several years, Georgia's Department of Behavioral Health and Developmental Disabilities, they've been using the health risk screening tool for years, and they're also using information in it for their annual mortality report. In this 45-minute free webinar, they'll briefly examine the latest report, its findings, and how you can use this data to avoid preventable unnecessary deaths among those you support. So 45 minutes, it's free if you are interested in that. It's not required. Kat dropped the webinar registration link in the chat if you're interested. And either check out the email blast or pick it up in the chat there in case you don't have that handy. And I'm going to pull up our Missouri Health Risk Screening Tool project webpage. I just want to, kind of talk about that a little bit and some updates. If you're with an agency that provides residential services, support coordination, and or rehabilitation and or employment services, and then you provide direct supports to DD waiver participants, now's the time to start onboarding for the Health Risk Screening Tool process or PRS process. This is our webpage. Please go to whichever ribbon that describes the services that your agency provides and then follow the instructions. Oops, wrong one. Recorded webinar, and then there's a recorded webinar specific to your service that you can review, and then there's a survey to fill out information, and we're working on enhancing that survey to cut out a lot of the extra items in there, so we just have your contact information and also who you want to be what's called gatekeepers, and you'll learn more about that once you get started. Once you filled out that information in the survey, we'll send you next steps for getting access to the system. We've been able to streamline the onboarding process to make it more efficient. We're continuing to transition our process for onboarding, but really go ahead and get started so that you can get onboarded, get your access, and then have your agency teammates who need to get access for the trainings and such that are housed in the system. Onboarding times have varied, and we've been working to transition into a more automated onboarding process to create a more expeditious and seamless experience for you. We're also finalizing some additional resources to post on our webpage, and we'll definitely communicate that out when we have those in place. Just for example, resources for support coordinators to assist with screening non-residential waiver participants, resources for individuals and families, training list for each role, so what to expect, an updated frequently asked questions document, and then an onboarding process diagram. Please don't hesitate to reach out for any questions, comments. If you need some support, we're working hard to respond to your emails. Here's MoDD HERS project at dmh.mo.gov within 1 to 2 business days. So yeah, don't hesitate to reach out. We will give ongoing support, and Inelectability also will be giving ongoing support throughout. I have one other item that I would like to talk about with Hearst. Jonathan Crumley from Inelectability, as I said, that's the company that created the Hearst tool. He and I will be appearing on the MoDD&U Lunch and Learn session, which is for individuals and families or whomever would like to join. But that's on February 28th from 12:30 to 1 p.m. And an email blast will be sent out related to that session. So if you're interested in listening in on that. And I have one more thing that is so exciting. Enable Dental is a company. Here, I'll pull up their flyer. But they are a dental organization who are trying to increase access for individuals with intellectual and developmental disabilities for dental care, just dental supports. It's pretty exciting, and I hope it will be able to grow in Missouri. In fact, we'd like to present to any group on this because it's just such an important need for people. Enable Dental Pilot Program, they had their phase 1 last year, and they are into phase 2 this year, starting at the end of February. They are working to increase access to dental care for individuals with IDD, and they work in collaboration with the Missouri Coalition for Oral Health. They are implementing this pilot phase 2 for teledentistry to serve individuals. Their dental team brings portable equipment and dental care into the patient's home, rehabilitation setting, or in the community, wherever is convenient. This phase of the pilot will be in the Kansas City area. However, if there is an interest in other parts of the state, please reach out because they would like to try to accommodate other areas as well, and that could help the pilot expand perhaps. So don't hesitate to reach out, and we will be sending an email blast here shortly immediately, I'd say in the next few business days, with the information so that you can reach out and take advantage of this. That is all I really have for updates. I'll stop sharing. Let's see. Okay, I'm looking at questions. Okay, there looks like some individualized questions. One, who should RNs contact with questions about completing the assessment? Well, it's a screen. There is support, most support at replacingrisk.com. I can put that in chat actually. Or Mo Clint, oops, I can't type. Mo Clin assist at replacingrisk.com. Our colleagues at Inelectability are there for support with any screening, rating questions, comments, concerns. They're here to help hone all of our skills when it comes to utilizing this tool. So please don't hesitate to reach out. And they'll even do like WebEx type sessions or Teams calls or whatever's more convenient for you all to kind of walk you through things. So when we fill out the survey questions, when will we be able to get access and complete the training? Okay, we're able to expedite that process. You'll fill out the survey questions and then we pull out your information and send you a brief. It's a 15-minute video that talks about what to expect. And after you guys are able to get that video, we will request access for your gatekeepers into the system. Then your gatekeeper will start requesting access for the different teammates. And once that usually takes about 1 to 2 business days, could be a little delayed because there's quite an influx of people wanting access. So after the gatekeeper is able to request your access, and your teammates will get emails from Inelectability that has the app website as well as login information, and they can log in and start immediately with the trainings. Okay, and it looks like there's a few people that I need to follow up with offline. And it said, here's one about, there's a video also, a recording about the UR process in regard to residential service providers and requesting additional RN hours as well as IP amendment. And this one, let me see if I can answer this. Yeah, the UR is a one-time, you just fill it out one time, and then it's to be an ongoing for each plan year for the ISP. So you only have to fill out that form once to send to the UR team. And please don't hesitate to reach out to that MODD Hearst project at replacing or at dmh.mo.gov. And like because there's a question in here about VBP. And if my team's not able to answer it, we will definitely get an answer for that, because we do have other team members who that's more their expertise, and we'll definitely give an answer for that to you. So please just don't hesitate to reach out. And oh, okay. Well, there's a lot of really good questions. Accessing the listing of screening questions so families can work on this independently to prepare for the screening. That's an excellent question. And there is a checklist that's a part of your training as a rater that will help you be able to, well, you could actually, yeah, you could share that with a family just to let them know what to expect. And actually that could be part of our messaging too. When we're doing outreach for individuals and families. So thank you. Oh, and then Emily put in chat, thank you, Emily, for specific VBP incentives. You can send those questions to dmhdd.vbp@dmh.mo.gov. And then the screen itself It is in the system, and different things can be printed out from her system, so that will be accessible that way. But all of the Hearst, like the trainings and all that stuff, is housed like in the system. So the screening and everything's in there. That was one other question. Thank you guys for the awesome questions and for the awesome feedback, because we're trying to use your feedback to make things go more smoothly and just for a better experience all in all, because ultimately we want to support the individuals to live happy and healthy lives. So I appreciate all of you jumping in here and moving forward with it. And okay, one more, and this is a good one. Will we have a way to access the training info after the training, like as a reference material? Yeah, you'll have a training library and you'll be able to look up anything you want to, because really it's a one and done training, okay? But you're going to have it for the duration. And just my experience, it's hard to remember everything that you've just like went through and learned. I mean, you got to practice it, you got to do it. And then, yeah, always go back and refresh if you have a question or you're doubting yourself. Yeah, definitely. So that's an excellent question. Will there be official guidelines coming out for SEs to follow on Hearst? I'm not really sure exactly what. I will get with this person's question offline for more clarification. But yeah, if you have questions or anything, just please reach out. We're here to support you through this. And with that, timelines for completion. Yeah, we do have a process document. We're going to review that and update it. If there needs to be more specific timelines, we are working on our internal policies related to Hearst as well as other items. So yeah, just stay tuned, and I'm taking that back to the table. Assistive technology providers who have medical data collection capabilities. Ooh. Oh, and then what will different people's monitoring on Hearst be, for example? Yeah, we'll outline that. These are excellent questions. Thank you. We will outline that. And that assistive technology provider question is intriguing. I don't know the answer to that, but we would like to, we will discuss it behind the scenes and see what that would look like. So pause a minute, because as soon as I'm getting ready to turn it over to Wendy, a question pops up, which is great. I like it. I like this. Okay, so okay, if you're noticing anything that's incorrect, that you're looking at profiles in the system, please reach out to the MoDD Hearst project at dmh.mo.gov, and we can help you fix anything that doesn't look right in the system when it comes to profiles. There has been some issues with the Seymour feed into the Hearst system, and we do have an IT crew diligently working on that, and I appreciate your all's patience with that aspect. And now I'm going to take these questions that you've put in chat and bring it back to my team. Make sure we have that handy, and I will turn it over to whomever is finishing us out for the day.
There you go, Leslie. It's Heike. I will take it over and wrap us up. So thank you for all the information that you shared. There are a lot of great questions on today's call. We'll make sure that any of those questions that are there that may not have been answered during the live webinar, that those get to the appropriate folks and who submitted those so that you can get a response. So with that, enjoy the long weekend. I hope the sun is shining where you are. It is here, so have a great weekend. Thanks.